Hi, my name is Kiara Hackett. I'm going to be giving a presentation today on Mycobacterium tuberculosis. So we're going to start out with the case study. A patient arrives at the hospital with a cough that has lasted for 2 weeks, a fever, chest pains, fatigue, and blood in their sputum. A TB test was performed. After the gram, acid fast, and endospore stains were performed, the results below were seen. So we're going to dive into the gram stain results. Mycobacterium tuberculosis has thick peptidoglycan cell walls, and these cell walls hold onto the primary stain, crystal violet. So the rods are going to stain purple, as you can see in the image to the left. That means that it is gram positive. Acid-fast stain results. Mycobacterium tuberculosis has cell walls which contain mycolic acid, so the primary stain carbofuscin is going to adhere. As you can see in the image to the left, they're going to stain red. That means that the result is acid-fast positive. The spore stain results. Mycobacterium tuberculosis does not have spores. So when the malachite green is put onto the smear, it's going to rinse off. It won't be able to penetrate any spores because there aren't any spores for it to penetrate. So the counterstained safranin is going to adhere and it will stain the cells pink. As you can see in the image to the left, the rods are pink. So that means that the results are spore negative. So what's the implication of these results? The patient came with symptoms of TB. They were typical symptoms: the persistent cough, chest pains, fever, fatigue, and bloody sputum. And the stain results for the smears are consistent with what is expected for Mycobacterium tuberculosis. Therefore, it's presumptive evidence of an infection with Mycobacterium tuberculosis. So the patient's infected with the bacterium, but does he or she have tuberculosis? The smears showed that he had the infection with Mycobacterium tuberculosis, but the doctor is probably going to call for a chest x-ray because that's needed to determine if the TB infection has progressed to an active TB disease. But the symptoms are indicative that it did progress to a disease. So this shows what the chest x-rays might show. The doctors are going to look for lesions or anything else abnormal, which can mean that the person has pulmonary TB. Spots on the lungs could possibly mean that the immune system is trying to contain the spread of the TB bacteria. So in the image to the left, it's highlighted in red to kind of show you what they're looking at. And then the image in the middle has the same thing going on. The red is highlighted. The diagnosis, if the patient's diagnosed with tuberculosis, an infection that's caused by Mycobacterium tuberculosis, what are you going to do? They can be treated with rifampin, which is typically in capsule form, as you can see down here at the bottom, pointed to with the red arrow. They're capsules. So some further info. Morphology. The bacterium is straight or a slightly curved, slender rod. It's very slow growing. The natural habitat of M. tuberculosis is infected humans, primarily in the respiratory tract of the infected host. Vaccine is BCG, but it's not always going to protect people from this disease. So how is it medically relevant? The likelihood that the average person in the US will be exposed to TB is very, very low. And then even if an individual is exposed to the bacterium, only about 30% of people exposed will develop latent TB. And if the latent TB is left untreated, between 5 to 10% of those people could end up with active tuberculosis disease. So basically, catching and treating TB in the latent stage is what's going to prevent it from being active and infectious. Transmission. So how did this patient become infected with Mycobacterium tuberculosis in the first place? The portal of entry is the respiratory tract. So an individual already contaminated with Mycobacterium tuberculosis that has led to active infectious tuberculosis can pass it to another individual, so it's communicable. When an infected individual coughs, sneezes, speaks, the droplets containing the bacteria are spread through the air, kind of like an aerosol. And a single cough contains 3,000 to 5,000 tiny respiratory droplets, and the tuberculosis bacilli is expelled with that cough. Typically takes 5 to 200 inhaled bacilli to cause an infection. So in this image to the right, you can see the infected host is talking or coughing, and the new host is being infected. There's the transmission. So some interesting facts. People can carry latent TB for years because it is so slow growing before it's going to become active. And additionally, if you're going into healthcare, you should probably be familiar with a TB test. A tuberculin skin test is when a solution containing a protein made from tuberculosis bacteria is injected just under the top layer of the skin on the forearm. The injection site will then be read at the doctor's office within 48 to 72 hours. If the skin test at the injection site develops a raised red bump, it indicates that the person may be infected with TB. So basically, you're going to go in and they're going to inject you with the needle at a slight angle so that it's an intradermal injection, and they're going to create what's called a wheal, which you can see in the image to the top right. There's a little wheal, and then you'll leave the doctor's office, and then when you come back within 48 to 72 hours, they will read or examine your injection site, and if it's raised or red, that indicates that you might have been infected with TB. And that's all I have for today. Thank you for your attention.